Assalamu alaikum. Beta, in this video lecture, I will continue the ovarian tumors. In the previous video lecture, I delivered serous tumors of the ovary, and it's now time for mucinous tumors of the ovary. Well, you can see, but I hope it is visible to you. Mucinous tumors of the ovary, they make up 20 to 25% of all ovarian tumors. Ovary में जितनी भी neoplasms होते हैं, ओवरी में जितने भी नियोप्लाज्म्स होते हैं उनमें से म्यूसिनस ट्यूमर्स ऑफ द ओवरी they make up 20 to 25%. Okay, and in what age of women these tumors can develop in the ovary? By the way, they can occur in the middle adult life. Okay, and they are rare before the puberty and after the menopause. तो बेटा जो puberty की एज है और जो menopause की एज है, यहाँ पे तो म्यूसिनस ट्यूमर्स रेयर हैं, लेकिन जो बीच में जो मिडिल एडल्ट लाइफ है, मिडिल एडल्ट लाइफ, देयर इट इज़ कॉमन. ओके, and majority of the mucinous tumors are benign and the borderline tumors. Okay, the malignant ones are not that common, unlike serous tumors. In case of serous tumors, we discussed previously, the malignancy were more common, but here in case of mucinous tumor, you can see benign and borderline tumors, they are majority. Okay, and when you talk about the malignant condition, that is the primary mucinous carcinoma, it is, by the way, uncommon. Only 3% of all cancers of the ovary. Okay, if we talk about now the pathogenesis of the mucinous tumors of the ovary, why does it occur? It occurs due to gain of function mutation in a proto-oncogene KRAS. Gain of function mutation in a proto-oncogene KRAS. Do you remember, beta, what was the genetic mutation in case of in case of serous tumor? The very first we discussed in the part 2 video. There was very important gene involved, BRCA1 and BRCA2 gene. But here in case of mucinous tumor, there is gain of function mutation in a proto-oncogene, that is a KRAS gene. Okay, and this KRAS gene mutation is present up to 58% cases of the benign mucinous tumor, that is benign mucinous cyst adenoma, and 75 to 86% of the borderline mucinous tumors, and 85% of the ovarian malignant mucinous carcinoma. Okay, so this mutation, KRAS mutation is the reason behind the mucinous tumors, benign, borderline, and malignant carcinomas. Okay, with the different percentage incidence. Okay, some other mutations can also be the reason behind mucinous tumor, but they are not known. If we then talk about the morphology of the mucinous tumor, let me take you to the morphology of the mucinous tumor. We will look at the mucinous tumor of the ovary grossly as well as microscopically. When you look at the beta, yeah, the mucinous tumor of the ovary grossly, there you will come to see that the surface of the ovary is rarely involved. Only 5% of the mucinous cyst adenomas and the mucinous carcinoma are bilateral. Okay, and the appearance is very much cystic, having multinucleated cysts that are filled with the sticky gelatinous fluid-rich glycoproteins. What does it mean? Let me tell you, beta. Number one thing is that the surface of the ovary is rarely involved. By the way, the mucinous tumor which we are discussing is actually the surface epithelial ovarian tumor. But here you can see that the surface of the ovary is rarely involved. Unlike serous tumors, which we discussed in the previous video, I told you that the serous tumors are the ones which completely appear on the surface of the ovary. But here, these mucinous tumors, they do not appear on the surface of the ovary. They rarely appear on the surface of the ovary. Okay, the serous tumors, they do completely appear on the surface of the ovary, and only 5% of the primary mucinous cyst adenoma, that are the benign mucinous tumor, and mucinous carcinoma, that is the malignant condition, they are bilateral, only 5%. And this is unlike serous tumors. Serous tumors, which we discussed previously, they were more bilateral. That means involving both the ovaries. But here in this case, the primary mucinous cyst adenoma, that is the benign mucinous tumor of the ovary, and the mucinous carcinoma, that is the malignant tumor of the ovary, malignant mucinous tumor of the ovary, they are just 5% bilateral, okay? 5% cases they are involving both the ovaries, okay? And if you talk about the appearance of the mucinous tumor of the ovary, the appearance is same as of the benign tumor, borderline, and the malignant tumor. Grossly, all the mucinous tumors, whether it is benign or borderline or malignant, it is very much similar. They all are having cystic masses. और एक बड़ा सिस्ट नहीं होता बेटा, एक जिस तरीके से होता है कि अगर ये एक सिस्ट है तो इस सिस्ट के अंदर बहुत सारी सब डिविजन्स होती हैं जिसको हम लोकाई कहते हैं. सो दिस इज़ अ बिग सिस्ट, और इस सिस्ट के अंदर बहुत सारे लोक्यूलेटेड एरियाज़ हैं. सो देयर इज़ अ सिस्टिक मैस. This can be as big as 25 kg. Don't forget, this is the data from your textbook, Robbins, okay? And this is a big cystic mass. This can be benign, borderline, or malignant mucinous tumor. So it's a big cystic mass which is actually multi-loculated, having multiple loci, okay? And these loci are actually filled with the sticky gelatinous fluid rich in glycoprotein. So it's actually a mucinous fluid which is very much sticky, very much viscous, okay, and composed of the glycoproteins. Let me show you beta how does it appear grossly, how does it look like. Can you see? I hope it is visible. So yeah, can you see beta, this is the gross appearance of the mucinous tumor of the ovary. Gross appearance of the mucinous tumor. This is a complete cystic mass. This is a complete cystic mass, and inside that cystic mass there are some loci. This big cyst is multiloculated, okay? And these are subcysts. These small cysts which are present inside the big cyst are the, okay, if you can consider it like that, this is entire tumor. These are the cysts which are present inside the tumor. These are the cyst inside the tumor, okay? And all these cysts are filled with the fluid that is very much viscous, that is very much sticky, composed of the glycoproteins, okay? This is actually the mucinous fluid. So it is multiloculated cystic mass, okay? This is the gross appearance of the tumor beta. If we then come to microscopy, then under the microscope, benign tumor is a little different, borderline tumor is a little different, and the carcinoma is little different. When you come to look at the benign tumor, अगर फर्ज करें बेटा ये कंप्लीट benign tumor है, उसके अंदर जो cyst होते हैं बेटा, सब cyst होते हैं, loci होते हैं. If you see, these are the loci, these are the cyst. We can consider this is a big tumor having small cyst inside, okay? And these cysts are lined by tall columnar epithelial cells. These cysts are lined by tall columnar epithelial cells, and yeah, there will be lack of cilia. Cilia will not be present. And yeah, I can say that yeah, these two are the cysts present inside the benign tumor. And inside of this cyst there will be the apical mucin that I discussed in the gross appearance, that there will be, gelatinous material, that is actually the mucin. And there will be gastric, this columnar epithelium behaves like a gastric or intestinal type differentiation, and in some cases endocervical type differentiation. So if you look the benign mucinous tumor under the microscope, what findings will you see? Number 1, this is a benign tumor, उसके अंदर cyst होते हैं. ये बात हमने ग्रॉस में डिस्कस की. ये देखें यहाँ पे हमने ग्रॉस अपीयरेंस में डिस्कस किया बेटा कि सिस्टिक मास होगा, जो ट्यूमर है वो सिस्टिक मास है, उसके मल्टीपल लोकाई हैं, उसके अंदर सिस्ट हैं उसके अंदर, ओके. और ये सिस्ट जो है बेटा इनके अंदर एपिकल रीजन पे म्यूसिन है, वही यानी कि स्टिकी जेलाटिनियस जो मटेरियल है वो मौजूद है। अब माइक्रोस्कोपी में आप देखोगे बेटा कि इस ट्यूमर के अंदर जो ये सिस्ट मौजूद हैं, जो लोकाई मौजूद हैं, these cysts are actually lined by tall columnar epithelium, okay, and this tall columnar epithelium is resembling more like the epithelium of the stomach or the intestine, and sometimes the columnar epithelium which lines here actually resembles the endocervical type differentiation, the actually epithelium of the endocervix. Okay, let me quickly show you, let me show you again from the picture. Yeah, I hope it is going to be visible here. Yeah, can you see here beta? Can you see this is this complete is a tumor, this complete is a tumor, okay, this complete is a tumor, और ट्यूमर के अंदर ये एक सिस्ट है, ये दूसरा सिस्ट है, ये तीसरा सिस्ट है, ये चौथा सिस्ट है, ये पांचवा सिस्ट है, अलग अलग सिस्ट हैं, ठीक है। यही बात हुई थी ना ग्रॉस अपीयरेंस में भी, हमने कहा था कि ट्यूमर जो होगा पूरा एक सिस्टिक मैस होगा, उसके अंदर ये लोकाय होंगे यानी कि ये सिस्ट होंगे, सिस्टिक मास होगा। ये पूरा जो ट्यूमर है ये सिस्टिक मैस है, यानी कि इसके अंदर सिस्ट मौजूद हैं, मल्टी लोक्यूलेटेड, ब्रेक हुए हुए हैं, एक लोकाय, दूसरा लोकाय, तीसरा लोकाय, ठीक है। और फिर हमने हिस्टोलॉजी में क्या कहा, हिस्टोलॉजी में ये कहा कि ये जो एक सिस्ट है ना, इसकी जो लाइनिंग वॉल है, लाइनिंग वॉल, इस सिस्ट की लाइनिंग वॉल में कौन सी एपिथेलियम होगी, टॉल कॉलमनर एपिथेलियम होगी। और सिस्ट के अंदर आप देखें ये एपिकल रीजन पे म्यूसिन मौजूद है, ये वही ग्लाइकोप्रोटीन रिच मटेरियल है, ठीक है, जो हमने ग्रॉस में बात की थी। ओके, और ये जो एपिथेलियम है बेटा, it looks more, this epithelium looks more like the epithelium of the intestine or the stomach, or the sometimes it looks like the epithelium of the endocervix. This is the epithelium. I just zoomed in and brought a very good picture. You can see this is the epithelium, okay, and this is the apical mucin present, and this epithelium, isn't it tall columnar epithelium, and isn't it looking more like the intestinal or gastric epithelium? Yeah, it is. Okay, so this is the microscopic yeah study of the benign mucinous tumor. For a quick recap beta, grossly all the tumors, all the mucinous tumors look similar, whether it is benign, it is borderline, it is malignant, it looks similar. What is the appearance? That this is a tumor and it is cystic. What does this mean? There are cysts present inside that, okay, which are multi-loci. इसको हम cystic भी बोलेंगे या multiple loci भी बोलेंगे, ठीक है। और हर cyst के अंदर क्या मौजूद है, जेलाटिनियस फ्लूइड मौजूद है, ठीक है। और इसको हम म्यूसिन बोलें, जेलाटिनियस फ्लूइड बोलें, इसके अंदर जो मेन प्रोटीन होती है अबंडेंट वो ग्लाइकोप्रोटीन होती है, ठीक है। फिर ये जो बेटा बिनाइन ट्यूमर, अच्छा ये अगर बिनाइन ट्यूमर है तो इसकी माइक्रोस्कोपी कैसी होगी, अगर आप सिस्ट को देखेंगे तो इसकी लाइनिंग वॉल में कॉलमनर एपिथेलियम होगी, और दैट शोज द गैस्ट्रिक और द इंटेस्टिनल टाइप डिफरेंशिएशन, एंड uncommonly it shows the endocervical type differentiation as well. Okay, when you come to the mucinous borderline tumors after the benign tumor, when you come to mucinous borderline tumors, you can distinguish from the cyst adenoma, that is the benign tumor, by epithelial stratification. The one we discussed above, that is the benign mucinous tumor, in that case there was a columnar epithelium, okay. But in case of mucinous borderline tumor, you will see there is epithelium present, okay, but there is a stratification of the epithelium, okay, and the epithelial cells are very much tufted, and you will see the intraglandular growth which was absent in case of the benign mucinous tumor. And when there is glandular growth, I will show you in the histologic picture that there is very much glandular growth, and due to this glandular growth it produces appearance very much similar to the tubular or the villous adenoma of the intestine. So what is the difference between the benign mucinous tumor under the microscope and the borderline mucinous tumor under the microscope? Benign mucinous tumor, it has columnar epithelium, इसके पास भी columnar epithelium है। इसकी columnar epithelium stratification शो नहीं करती, इसकी columnar epithelium stratification और tufting शो करती है। इसमें glandular growth नहीं होती, इसमें glandular growth होती है, ओके। और इस ग्लैंडुलर ग्रोथ की वजह से ये किससे रिजेम्बलेंस रखता है? ट्यूबुलर और द विलस एडिनोमा ऑफ द इंटेस्टीन, जो इंटेस्टीन में बिनाइन कंडीशंस मौजूद होती हैं, बनती हैं, ट्यूबुलर और विलस एडिनोमा, उनसे रिजेम्बलेंस रखता है। ठीक है। इफ़ आई कैन इवन शो यू द ग्लैंडुलर ग्रोथ, ओके, एंड आई होप आई कैन शो you the epithelial stratification as well. So if you see this picture, here, you will find this is very much complex structure, by the way, and this is the borderline mucinous tumor. You can see this is the glandular growth, and it is looking more like the villus adenoma of the intestine. Okay, and this is again the mucin present. Okay, this is the cyst wall, and this is the cyst. Actually, this is the cyst filled with the mucin, and this is the cyst wall. Okay, having showing the epithelial stratification. You can, if you zoom into this is okay, this is the epithelium. This is the epithelium, and showing very much tufting of the cells and stratification of the cells. Okay, and also you can see this is the gland, this is a gland, this is the gland, this is the gland, this is also the gland. So it is showing intraglandular growth, okay, with the epithelial stratification, and tufting. And it is actually resembling what condition of the intestine? Tubular or villus adenoma. Okay, but when you come to the mucinous carcinoma after borderline tumor, mucinous carcinoma और borderline में सिर्फ एक फ़र्क होता है कि कार्सिनोमा के अंदर देयर इज बैक टू बैक कॉन्टिन्यूएंट ग्लैंडुलर ग्रोथ, इतनी क्विक और इतनी बैक टू बैक ग्लैंडुलर ग्रोथ। ओके, एंड देयर इज एक्सपेंसाइल इन्वेजन तो बेटा ज़ाहिर है कार्सिनोमा में ही होगा, इन्वेजन बॉर्डर लाइन और बिनाइन में तो नहीं होगा। ठीक है, और इसमें ग्लैंडुलर ग्रोथ का फ़र्क तो है ही है, इसमें ग्लैंडुलर ग्रोथ है लेकिन कम है, लेकिन कार्सिनोमा में बेटा आप जब देखोगे तो देयर विल बी back to back glandular growth. This is the carcinoma. Can you see? This is the carcinoma, beta. Can you see how rapid is the glandular growth? This is the gland, this is the gland, then gland, again gland, again gland. All these white spaces are the glands. Okay, there is the back to back glandular growth, back to back glandular growth. This continuant back to back glandular growth is the characteristic feature of the mucinous carcinoma. Okay, I hope you are clear with this, beta. And the 10-year survival rate is okay, depends beta. अगर नॉन इन्वेजिव इंट्रा एपिथेलियल कार्सिनोमा है, हम इसकी बात करते हैं। अगर कार्सिनोमा आपने डेवलप कर लिया है और लेकिन वो इंट्रा एपिथेलियल है, यानी कि अभी ओवरी के अंदर है और नॉन इन्वेजिव है, तो इन दैट केस द 10-year सर्वाइवल रेट विल बी 95%। लेकिन अगर स्टेज 1 इन्वेजिव कार्सिनोमा है तो 10-year सर्वाइवल रेट विल बी 90%। ओके, अगर म्यूसिनस कार्सिनोमा बेटा इफ़ इट हैज़ स्प्रेड बियॉन्ड द ओवरी, दिस इज़ द पॉइंट, देन ऑब्वियसली 10-year सर्वाइवल रेट इज़ नॉट गोइंग टू बी वेरी गुड, ऑल्दो इट इज़ गोइंग टू बी फैटल, क्योंकि कार्सिनोमा ओवरी से आगे निकल चुका है। ओके, वन मोर टर्म बेटा, वन मोर कॉन्सेप्ट आई हैव टू ऐड इनटू दिस, एंड देन वी आर डन विद द म्यूसिनस ट्यूमर्स ऑफ द ओवरी। बेटा, द कॉन्सेप्ट ऑफ pseudomyxoma peritoni. Pseudomyxoma peritoni is a kind of condition beta in which you come to see different clinical presentations. If somebody develops pseudomyxoma peritoni, by the way, initially historically it was thought that the woman who develops the mucinous tumor of the ovary, especially the mucinous carcinoma of the ovary, she later develops pseudomyxoma peritoni. But currently it is considered that recent evidence is that it is not the mucinous tumor of the ovary. However, there is extra ovarian origin, that is some malignancy in the appendix that lead to the development of the pseudomyxoma peritoni. So what did I say, beta? Historically, it was thought that in women, many cases of the pseudomyxoma peritoni were due to the primary ovarian mucinous neoplasm, that is the neoplasm of the ovary. But recent evidence suggests that source is not ovary, it is somewhere extra ovarian, that is usually appendix. Okay, so let's see. But what is actually pseudomyxoma peritonei? Doesn't matter if it occurs in the mucinous tumor of the ovary. Doesn't matter if it is occurring in as a neoplasm of the appendix. Doesn't matter. But what actually it is? It is characterized by the presence of the mucinous ascites. इससे सजेस्ट होता है था पहले कि लेट सपोज ये अगर ओवरी है बेटा और ओवरी में किसी को म्यूसिनस ट्यूमर होता है और ये पेरिटोनियल वॉल है फ़र्ज़ करें, तो यहाँ पे जो म्यूसिनस ट्यूमर के अंदर म्यूसिनस है वो निकल के यहाँ पे डिपॉजिट हो जाता होगा म्यूसिनस मटीरियल और एक्सटेंसिव म्यूसिनस असाइटीज़ हो जाती होगी एब्डोमेन में। तो इस चीज़ से सजेस्ट होता था कि शायद सीडोमिक्सोमा पेरिटोनाई जो है ओवेरियन मैलिग्नेंसी से आती है। ओके, वन मोर कंडीशन दैट इज सीन इन सीडोमिक्सोमा पेरिटोनाई, दैट इज द सिस्टिक एपिथेलियल इम्प्लांट्स। Cystic, this is by the way the ascites, mucinous ascites, and then is at number 2, cystic epithelial implants on the peritoneal surface, that is presence of the ovarian epithelial cells to the abnormal side, that is peritoneum. So the epithelial cells of the ovary which should be present normally here, but these epithelial cells are now present on the peritoneum as peritoneal implants. Okay, so this is also seen in case of pseudomyxoma peritonei. Adhesions, intestinal adhesions, and the frequent involvement of the ovaries, and if it becomes very much extensive, it can result in the intestinal obstruction and the death of the individual. Let me quickly show you the pseudomyxoma peritonei beta. This is pseudomyxoma peritonei. Can you see these mucinous material deposited on the peritoneum all over the liver and the matlab over the liver and the stomach and the on the mesentery of the intestine? Can you see this on the mesentery of the intestine? And this is the mucinous material deposited. Okay, this is the mucinous material over the mesentery of the intestine. This is the mucinous material. Okay, so this is the case of the pseudomyxoma peritonei, and you can see the intestine has been completely obstructed by the mucin. So this obstruction of the intestine can be very much fatal, can lead to the death beta. So if somebody comes to you with all these conditions, it is the pseudomyxoma peritonei, and previously it was thought that all these conditions develop actually due to malignancy of the ovary, but it is now considered that it is not ovarian, but it has some extra ovarian cause, that may be the some pathology in the appendix. Okay, so this is all about the beta mucinous tumor of the ovary. Later I will continue with the other tumors of the ovary beta. Thank you so much. Class dismissed.